This is what the ankle does. It helps with stability and balance and any plant and pivot maneuver. Hey everybody, good to see you. It's Dr. Curtis, your doctor of physical therapy. I'm going to be sharing with you how to rehabilitate one of the most common ankle problems, and that is an ankle sprain. All right, so stay tuned. So these are the ligaments of the lateral ankle. Here's the calcaneus, the fibula, and that bump that you feel on the outside, that's the tip of the fibula. It's connected by 3 ligaments down at the tip. In general order of severity, a minor ankle sprain will tweak this anterior talofibular ligament, connects the talus to the fibula. An intermediate ankle sprain will involve the calcaneofibular ligament, and a more advanced inversion ankle sprain will involve all 3, anterior, calcaneofib, and posterior talofibular ligament. In order to properly rehab an ankle sprain, first you need to know what it is and which ligaments you're rehabilitating. So, what you're going to need to do first is look at your motion, typically flexion, dorsiflexion, and plantar flexion, and to see how that moves compared to the good side. And we looked at inversion and eversion, inversion and eversion. The most common type of ankle sprain is an inversion sprain, like this, okay? So rolling your ankle like that. So the problem with ankle sprains is after they heal up, you can actually run and walk on it pretty good. And you think it's 100%, but it's still healing up, especially if you get a grade 2 or grade 2 plus to a 3. That ankle sprain can take up to 12 months, sometimes even more, to fully scar down and heal and finish the healing process. So often it's kind of sneaky, is that you're walking, even running around, and you feel no pain. You feel like you're 100%, but that ligament is still healing up, and that's what leads to a re-injury and a chronic ankle sprain. So what we're going to do, simple assessment, is I look at range of motion to see if there's any deficit from affected side to non-affected side. Then we look at strength. We have to go unilateral and a simple heel raise, 5 times up and down, looking at the quantity and also the quality of it. They go on the affected side, they can't go up all the way, or can only do 3 or 4. Are they really laboring? That shows me that there's a certain amount of deficit. After strength, we look at balance. Typically a one-legged stance will do it. Bend the knee, hip slightly, and static stability. We can time that, and we look at the quantity again and the quality. And the affected side, if they're having trouble making the time, the quantity, and then their foot's really working really hard compared to the other side, or if they lose their balance, or if their arms are coming out, and it gives me an idea of, wow, that's significantly off, a little off, or whatnot. That's something that we need to work on. So range of motion, strength, and balance is typically what I look at. Next, we're going to look at how to rehabilitate these things. So range of motion, if there's a deficit in dorsiflexion, plantar flexion, or inversion or eversion, you're going to work on those little bit of stretches. Dorsiflexion here, plantar flexion, you have to kind of do sitting and drag that toe back for plantar flexion, and inversion and eversion. You can use a towel to work on that and hold it. Sometimes with significant ankle sprains, that ankle is actually stretched, so you don't really see a deficit of the affected side, where you don't really need to stretch it anymore. We actually need to stabilize it more. So rehabilitation, range of motion, strength, heel raises is typically what we need to do if we find a deficit. So we're going to do the typical PRE, or progressive resistive exercise, with 1 set of 10. And do this heel toe rocking. 1 set of 10 for a couple days, a few days, and work your way up to 2 sets of 10. And progress that gradually, where you're doing 3 sets of 10. Okay, it's important with the calf, especially, to not to do too many in the beginning, because for some reason your calf muscle, since it's your main mode of ambulation and walking, it'll allow you to do a lot of work, just like your quads and your glutes. Like if you work in the garden, you do a lot of work, and then afterwards you realize, whoa, I did too much, you can barely walk. If you do these exercises too much, too soon, you can overwork that muscle group, and it'll be hard to walk, and it'll be sore for a good 2, 3, sometimes even 4 days. And if you do that, definitely that's too much. So it's important to listen to your body, listen to the instructions, and only do 1 set of 10 the first couple days, and then the next couple days later on in the week, work your way up to 2 sets of 10, and then 3 sets of 10. So that's strength. And then balance. One-legged stance. You can bend that one leg. You could do static and work your way up to 15 seconds, 30 seconds, 45 seconds, even a minute. And you can see what you do on your good side to see what your normal is, and that's when you know that you're getting closer to 100%. Okay, so that's balance, static balance. You could do dynamic balance by doing some toe tapping. So static, then tap in front, tap in back, tap in front, tap in back. You can see I'm adding this rotatory component to the exercise. Again, you always want to go to your non-affected side to see what your normal is. Okay, dynamic balance. Now we're doing even side steps. Okay, side steps, bigger and bigger, faster and faster. Even skipping like this, and then crisscross steps, a little plant and pivot maneuver. I kind of like this one. Even for non-athletes, if you're going hiking and whatnot, this is what the ankle does. It helps with stability and balance, and any plant and pivot maneuver, those lateral stabilizers are going to work, and they need rehabilitating if you have a pretty significant ankle sprain. Okay, that's how you rehabilitate the ankle, the most common injury in the ankle, an inversion ankle sprain. Don't forget to subscribe, like, and share this with someone you care about. This is Dr. Curtis. You take care, and we'll see you next time. Bye-bye. Ouch. And if you just get a small pillow, shove it back there, it's going to help straighten things up. These 3 things are really going to help you.